It's not always easy to find trustworthy and reliable healthcare online, especially when it comes to finding the right information when having to choose amongst medications. But this telemedicine organization has combined tech experts with healthcare and put patient communication and education at its forefront. Healthcare should be meeting the standards set by so many of the other typical online brands out there. Yet this doesn't seem to be the case until now. DirectMeds is a patient experience orchestration platform that is changing the way it provides safe medications and education on those medications to its customers. And with a growing demand for different GLP-1 options targeting weight loss and management, they're providing a solution to a very big problem.
DirectMeds provides technology to seamlessly connect telemed patients with qualified doctors and certified pharmacies for a safe and transparent online experience. Our mission is to bring consumers direct access to quality patient care and affordable GLP-1 medications.
With a dedicated nursing team that is bridging the gap between patients and doctors, patients can feel confident in understanding their medications, a full transparency policy.
DirectMeds has found that in order to have a comprehensively safe patient experience, it needs to have a dedicated nursing unit. Proper administration of GLP-1 medications will include many customizations and dosages for each patient, which means having a thorough system of healthcare becomes even more important than just easy access.
Here to tell us more about the necessary marriage of healthcare with tech experts is Chris Armstrong and Mitch Grommans. Gentlemen, thank you for being here. My bias, of course, is getting things to the patients. So, Chris, how are you guys doing that?
Yeah, so our whole business is built around technology that brings medications directly to consumers as fast and safe as possible.
As the fulfillment center for the telehealth brand, we are a pharmacy that focuses on accuracy and quick turnaround to make sure that the right medication that your doctor prescribed for you gets in your hands as easy as possible.
So let's kind of break this down a little bit. So you're the pharmacy fulfillment center, which is a key piece of this whole operation. But you're getting information from telehealth physicians throughout the country?
Correct. So DirectMeds is a patient orchestration platform. Our job is to make sure that we have all the right vendors available. For us, we're looking at the pharmacy, making sure that they're properly licensed, making sure that they have the right safety protocols. But even more importantly, our job is to make sure that we have a doctor network that covers every patient for every state that allows for medications that we'll be selling.
There's no doubt in my mind that telehealth is, not only is it here, but it's the future. It's the solution to so many of the healthcare problems. So I'm a huge, huge fan. Do you set up your own physician network, or do you use a particular network?
We use a particular network, or a variety of networks depending on what medication we're considering. Our job is to evaluate what are the patient demands, what are they looking for, and then what vendors do we use for doctor networks to make sure we can facilitate that.
Generally, you are, for people that are interested in certain medication, getting them access on their terms.
Yes, that is true. However, I will give DirectMeds credit. A lot of telehealth nowadays is being so hyper-specialized. They're breaking down to one particular drug, one particular treatment.
Yes.
And you have to, let's say you wanted a full array of what your primary care physician would provide, you're piecing together different telehealth brands to make a full health care. What DirectMeds is doing is, because those doctors don't specialize in one particular thing, you can go there for multiple different disease states. That is, I think, the biggest disconnect in a lot of the telehealth companies.
Are there particular products that you highlight or that you're involved with?
The one that's in the hottest demand for us right now is GLP-1 medications for weight loss.
So who and how are they making the decisions on dosing and then termination of care?
So the patient is likely going to be the first one to report some type of concern. Maybe they're not losing weight fast enough, and they'll likely either escalate that directly to a doctor, and then ultimately the doctor will make the decision on whether they change the dosage. And then particularly once they come to the end of their weight loss goals, they'll be discussing whether they stay on a maintenance dose or not.
Got it. Appreciate you guys being here. Thank you so much. If you want to find out more about DirectMeds, go to direct-meds.com. Again, direct-meds.com. Stick around.